Dr. Chauncey Crandall has been a heart specialist for 28 years, and along with his busy cardiology practice in Palm Beach, Florida, he is also on call to treat cardiac emergencies at 3 South Florida hospitals. So when it comes to heart disease, Dr. Crandall can honestly say he has seen it all. He has seen and fixed the hearts of billionaire bankers and poverty-stricken villagers in third world countries. He has seen and repaired the hearts of blue-collar auto mechanics and professional athletes. He has seen and mended the hearts of both the ordinary and the eccentric. And he's traveled all over the world to nearly every continent to share his heart disease treatment methods with other health professionals. But of all the cases he has seen throughout the world, one case still troubles him to this day, nearly a decade later. This was a terrifying case, not just because of who it happened to, but because it didn't have to happen. So I hope you listen closely to this story Dr. Crandall is about to tell you in his own words. It is 100% true and just might save your life.
It was the fall of 2002. A middle-aged man returned to LaGuardia Airport for his flight home following a business trip. As he pulled his travel bag out of the back seat of his car, he felt a sharp pain in his left shoulder. As most of us would, he shook it off as a minor muscle pain. And when he boarded the plane, the painful sensation stopped. When his flight landed and he picked up his bag again, the pain returned. Yet by the time he got home, he felt perfectly fine. Later that evening, he was so excited to see his family, he barely noticed the pain. It began to bother him again. It certainly wasn't severe enough to prevent him from taking his sons on an outing. He'd stop and rest, feel better, and try to catch up with his kids, but then immediately the soreness would return. For a second, this man did consider if the pain was coming from his heart. But he was, after all, only 48 years old. He didn't smoke. He didn't have any family history of heart disease. He wasn't a diabetic. So the next morning, when he felt perfectly normal, he decided the pain must have been a fluke or brought on by the stress of his demanding career. And after all, he was athletic and he was used to the little aches and pains that went with tennis, swimming, and other exercise. So when his wife went out for her daily run, he decided to walk along behind her. But he couldn't even make it to the end of the driveway before severe pain set in. This time he knew he had to go to the hospital immediately. And by the time the medical team had him on the table in the emergency room, he was screaming in agony. He had what was called the widowmaker. The widowmaker is a blockage or stenosis in the left anterior descending artery of the heart. This artery, the LAD, feeds the bulk of your heart muscle. Unfortunately, this blockage commonly results in death, hence the name. In this gentleman's case, his LAD was 99% blocked. His heart was literally starving for blood. Doctors quickly rushed him off to the emergency heart surgery. And fortunately, I'm happy to tell you this story had a happy ending. He survived. Because of his own near brush with death, he made simple life changes that have kept him healthy and robust even today. The very same changes I'll be revealing to you in just a few moments. Simple changes you can use to prevent or reverse heart disease. But first, I want you to meet this man and put a face to his story. Yes, that's me in the photo, and oh, by the way, this is my story. Hello, I'm Dr. Chauncey Crandall. I know heart disease inside and out. During my training, I spent many days in the basement laboratories at Yale Medical School creating heart disease in order to help me learn more about how to fight it. I've run heart transplant programs and have treated thousands of heart patients. Yet despite all this, I nearly died from heart disease myself. Unfortunately, heart disease is often a silent killer. In fact, about 25% of all heart attacks happen silently, without clear or obvious symptoms. And oftentimes, when symptoms exist, they are only mild or vague, so you may attribute them to indigestion or stomach flu, fatigue, ordinary back pain, or plain old stress. That's why I've made this video, to give you some simple steps to help you easily prevent or even reverse heart disease before something major happens. so you don't have to go through what I did. You see, I believe God has given me a special role to play. He helped save me for a reason, to save lives through my medical practice, and also to share the life-saving information I've gained over the years. Share it with folks like you, because heart disease is the #1 killer of Americans, responsible for nearly 1/3 of all deaths. It kills more men and women each year than all cancers combined, including breast cancer. And shockingly, most Americans over 35 already suffer from heart disease, whether they know it or not. But there's good news. Heart disease is completely unnecessary because it can be prevented, reversed, even cured. By all rights, I shouldn't even be in business. Why? Because heart disease shouldn't exist. And now I'm going to show you how to help put me out of business, or at least never need my professional medical help. And I'll tell you about the very simple strategies I use not only to heal myself, but also to heal patients I see daily in my cardiology practice. Patients who no longer have to live with the nightmare of heart disease and are no longer dependent upon expensive prescription drugs. So I urge you to watch this video all the way through until it ends. Because I've made a commitment, I've put all my heart disease reversing strategies into a special package just for you. And today I'm going to make my heart disease prevention and reversal kit available to you as a special free gift. Now perhaps you have high triglycerides or high LDL cholesterol or high blood pressure or angina pain or a high degree of inflammation in your body, all of which will fuel heart disease like gasoline on a fire. You may be taking heart or blood pressure medication or at least a cholesterol-lowering drug, and you might even know your total cholesterol number. But knowing your cholesterol number isn't good enough, because about half of all people who die from heart attacks have cholesterol readings considered to be in the normal range. Today I'm going to show you how to actually prevent and cure heart disease so you may not need treatment for problems with your heart and probably not for other degenerative diseases as well. You see, what causes heart disease also causes many other major degenerative diseases. And if you follow my guidance in your heart disease prevention and reversal kit, which will send you free when you try my newsletter for a few pennies a day, you'll be giving yourself the best chance for a long, healthy, disease-free life. My patients are always surprised to learn these facts, including this one. To this day, some cultures in the world experience little or no heart disease. I know this firsthand because my two passions are heart medicine and anthropology. I've traveled the world studying cultures free of heart disease, trying to figure out what they do that we in America don't. Today, I'm chief of the cardiac transplant program at the world-renowned Palm Beach Cardiovascular Clinic in Florida, where I also practice interventional, vascular, and transplant cardiology. And as a frontline interventional cardiologist, I can tell you that we in the West are creating epidemic rates of heart disease, diabetes, arthritis, and cancers, largely because of one reason that I'll share with you shortly. And then we're asking doctors, hospitals, and pharmacies to save us. I've got a better idea. You save yourself. And if you keep watching, I'll show you how. So what actually causes heart disease? For years, it was hard to pin down, especially since it seemed to vary widely from person to person. But we've learned a lot over the years, and today we know exactly what the process is and how to stop it. Unfortunately, there are two main culprits: sugar and fat. These combine to create too much fat in your bloodstream, which in turn sets the stage for arterial plaque formation or atherosclerosis and other diseases too. It should be no surprise that we have the highest death rates from heart disease right here in the United States. Because of the typical American diet is absolutely loaded with sugar and fat. And what's more, modern processed foods have additives that promote inflammation, which also contributes to heart disease. These factors also do their part to bring on heart disease: stress, high blood pressure, smoking, lack of exercise, hormonal imbalances, overproduction of insulin, increased inflammation. The good news is, once you know how heart disease starts and what fuels it, you can easily stop and even reverse it. And if you choose to stick with my guidance, I'll make sure you have several practical options to get healthy and stay healthy. You probably already know your cholesterol is made up of good HDL and bad LDL types. But that's just the half of it, because the bad LDL cholesterol is especially bad if it's the small, dense pattern B form. Some doctors just give you a total cholesterol number such as 190, and you might think that's a good number, but not necessarily. You need to know how much of your cholesterol is the good HDL type and how much is the bad LDL type. And in your heart disease prevention and reversal kit, you'll see what both numbers and their ratio should be for your best health. But there's even more to know. You must find out whether your bad LDL cholesterol is the larger, less dense pattern A type or the smaller, highly dense pattern B type. Too much pattern A is not good, of course, but pattern B is very dangerous. Fortunately, there's a test to determine whether you have pattern A or pattern B LDL, but it's rarely given unless you ask for it. I also advise getting another new test, the plaque test, that measures your plaque and is remarkably accurate in predicting your potential for deadly heart attack and stroke. And that's why I want you to have a free copy of Must-Have Heart Test for everyone over 50. You'll receive this as one of 4 reports in your complimentary Heart Disease Prevention and Reversal Kit. Plus, I want to make sure you discover how to boost your HDL, which then makes your pattern A LDL less harmful. This and much more is in your free copy of the 7 Keys to Reversing Heart Disease for Life, another of the 4 reports in your free kit. Just knowing these things alone could save your life. But there's more I'd like to share with you. Your body makes cholesterol to serve many important metabolic functions. In fact, you couldn't live without it. So contrary to popular belief, cholesterol is not a dirty word and it's not your enemy. The chief problem is when you have too much LDL relative to your HDL, especially if your LDL is the pattern B type. This dangerous combination occurs when you have a diet high in sugar and fat. And it's worse than when you get too little exercise, smoke, are under stress, or have too much inflammation in your body, even if it's from an infection or plain old arthritis. These are the kind of things I discuss in my Heart Health Report, a Newsmax publication that helps you become a more informed patient. Sadly, most doctors don't have the time to educate their patients, nor do they always know about the latest advances. In fact, let me show you something else your doctor may not be telling you. Your arteries are comprised of millions of cells aligned in what cardiologists call tight junctions. But stress, inflammation, hormonal imbalance, and high blood pressure can stretch the artery and damage it in places, allowing small, dense, and dangerous pattern B LDL particles to embed in these tight junctions. This is the beginning of heart disease because it triggers an inflammatory immune response. And you'll hear all about this in Reversing Heart Disease, my 2-part plan for success, a report in your free kit. But for now, here's the basic idea. It's like getting a splinter. Think about what happens when you get a splinter in your finger. It swells, it turns a little red. That's your normal immune response isolating it in order to expel it, which it typically does in a few days. Some people do this quite well, but others can't leave a splinter under the skin because it will become inflamed and infected. Now a similar process occurs with the embedded LDL particle in your arteries. Your immune system goes to work to repair the damage, but the normal inflammation process creates something akin to a blister. Some people heal these blisters just fine, but many others, and this explains why some people are more prone to heart disease than others, don't make the repairs very successfully. And of course, you can't dig the LDL particles out of your arteries as you would dig splinters out of your skin. So, the embedded fat particle triggers inflammation, which creates a blister, which attracts more fat particles, and this starts the plaque buildup. What happens is your body tries to heal this condition by sealing the plaque with red blood cells, making something like a scab. But this sealing process also can go haywire, causing hardened blood clots to form, and the rupture of these clots causes most heart attacks and strokes. Look here. If you have triglycerides over 150, pattern B LDL cholesterol, and low HDL, you'll build plaque faster, which over time calcifies and hardens. And if a piece breaks off and travels to your heart or brain, it can kill you or leave you debilitated for life. I'm not going to let this happen to you, not if I can help it. And that's why I want you to have the Heart Disease Prevention and Reversal Kit as my gift to you, and also start reading the Heart Health Report each month. Before getting into details about how you can claim your own free kit when you try my newsletter for a few pennies a day, I'd like to make sure you see the truth about the connection between heart disease and inflammation. Today, medical researchers are realizing more and more that numerous diseases are caused or influenced by chronic inflammation, including heart disease. And when you start reading Heart Health Report, you'll see all the different ways you can reduce inflammation so you can avoid many health problems. But now you already know how heart disease gets started and then progresses. So here are just a few things you can do right now to prevent, reverse, and cure heart disease. First, you need to quit smoking. If you smoke, get medical help if you need to. Next, get more exercise. You know you need it. Additionally, make sure you have a release for stress. You can use physical outlets like tennis, golf, or fishing, or more spiritual or religious means such as prayer or meditation. Next, I strongly advise that you cut out all sugars and cut way back on refined carbohydrates that convert to sugar in your body, plus cut back on fatty foods. You'll want to increase your intake of fresh fruits, vegetables, nuts, and whole grains. Fish and chicken are okay, and even a little lean red meat on occasion is fine. In your free copy of Fight Heart Disease with Dr. Crandall's Life Plan Diet, also part of your kit, you'll see exactly what to do. And very soon, you'll feel so good on your new diet, so energetic, and so much younger, you'll wonder why you didn't do this years ago. Okay, I hear at least one objection. But Dr. Crandall, I can't give up my nightly ice cream. Ah yes, the perfect combination of sugar and fat, and so delicious too. Well, I hear you loud and clear. And believe it or not, my patients, even those who have had heart attacks, routinely tell me the same thing. So this is as good a time as any to explain what I do as an interventional cardiologist and also explain why you're going to love your free Heart Disease Prevention and Reversal Kit, plus reading my Heart Health Report every month. I have a medical philosophy for working with my patients that's best expressed as, I meet you right where you are. And then I work with you on a comfortable course of treatment to achieve the best outcome over time. For example, if you were to come to me as a heart patient, I would use everything in my medical arsenal: conventional medicine, emerging treatments, lifestyle changes, and a few specialties of my own to get you well as quickly as possible. I'd want you to be symptom-free, drug-free, and as stress-free as possible. But I understand that everyone is different, and that's why I assess everything that's going on with my patients, including what they're likely to do and not do before prescribing a course of treatment. Of course, with every patient, I seek to stop heart disease in its tracks and reverse it. But what good is it if I insist on an ultra-strict plan that you can't follow? And that's why I offer you several options for both resolving and reducing heart problems and risks. For example, I'd rather you didn't use statin drugs, but I might prescribe them to quickly get your numbers under control while urging you to make lifestyle changes to control them naturally over time. Or I might have you take a low-dose statin every other day, which greatly reduces the chance of side effects. Many of my patients do very well on this regimen. One thing I want to impress upon you is this: bypass surgery should be your last resort. If you had a cardiac event and were in the hospital with a heart surgeon insisting on bypass surgery, I tell you to get a second opinion and consider balloon angioplasty and the new stents. In most cases, These are proving very effective without the trauma of open heart surgery. Most important, I'd give you the perfect plan to totally eliminate heart disease from your life. But I also give you a plan B and a plan C. The important thing is to just get started with prevention and reversal, because small improvements in heart disease will make big improvements in your overall health. Of course, what's right for one patient isn't always right for the next. That's why you need to know all of your options. And with knowledge, guidance, and support, you can reverse heart disease and go on to eliminate it from your life completely. The good news is this: there are many excellent options today, and that's why I want you to have this valuable free kit that's loaded with practical information you can use right away. Just look at everything you'll receive in your own 4-report Heart Disease Prevention and Reversal Kit. Here's your first free report. Report number 1, Reversing Heart Disease, my 2-part plan for success. In this report, you'll see why even mildly elevated blood pressure is called the silent killer, how a heart attack most commonly sneaks up on you, and what you can do to prevent it, the real reasons why elevated inflammation can make your heart disease even worse, why all stress is bad stress when it comes to your heart, how even a minor reduction in the plaque in your arteries can result in major health improvements, your most important targets to reach if you want to reverse heart disease. Then you'll also get your second report, report number 2, 7 keys for reversing heart disease for life. In this report, you'll discover why losing just 10 pounds may actually work as well as blood pressure medication. When and how to use statin drugs. Do you really need them? How simple walking dramatically cuts your risk for heart disease. Heart-healthy supplements and diet secrets your doctor won't share with you. Why your spouse can be your #1 stress reducer. Plus, you'll also receive a 3rd free report. Report number 3, must-have heart tests for everyone over 50. Here you'll see the fabulous 15 heart tests. You may not need them all, but you're almost certain to need more than you've had up to this point. When to avoid having a CT scan for coronary artery disease. The most important piece of exercise equipment in your home, and it's not what you think. How to find out the true age of your arteries. See why a 40-year-old man could actually have the carotid arteries of an 80-year-old. What never to do before a fasting blood sugar test. The new plaque test that can measure your likelihood of plaque rupturing, leading to most heart attacks and strokes. And last but certainly not least, you'll receive a 4th free report. Report number 4, Fight Heart Disease with Dr. Crandall's Life Plan Diet. In this report, you'll discover the diet that cuts your heart disease risk by 17 times, how to use heart medications temporarily as a bridge while you make the changes that make drugs unnecessary, why you should eat like a caveman or woman, what people 100 years old or older do to stay healthy that you are probably not doing, how my Life Plan Diet incorporates the best of popular heart-healthy diets and avoids their danger, how often you should eat red meat, the most powerful motivator to help you beat heart disease. Does this sound like a great gift package for you? You bet it is. Take advantage of this opportunity to claim your own free heart disease prevention and reversal kit. Plus, start reading my Heart Health Report for just a few pennies a day for all the information you need to live healthy. Don't be a sitting duck for heart disease, and don't let your loved ones suffer either. It's not necessary anymore. Not when you can follow these simple steps to prevent, reverse, even cure yourself of heart disease. Oh, by the way, my heart is in great shape today. With the very same strategies I've been sharing with you, the same methods you'll discover in more detail in your free kit, I've reversed my own heart disease. And you can reverse or prevent problems with your heart too, just like I did. This is Dr. Chauncey Crandall, your heart health partner, And thanks so much for listening.
Dr. Chauncey Crandall has been a heart specialist for 28 years, and along with his busy cardiology practice in Palm Beach, Florida, he is also on call to treat cardiac emergencies at 3 South Florida hospitals. So when it comes to heart disease, Dr. Crandall can honestly say he has seen it all. He has seen and fixed the hearts of billionaire bankers and poverty-stricken villagers in third world countries. He has seen and repaired the hearts of blue-collar auto mechanics and professional athletes. He has seen and mended the hearts of both the ordinary and the eccentric. And he's traveled all over the world to nearly every continent to share his heart disease treatment methods with other health professionals. But of all the cases he has seen throughout the world, one case still troubles him to this day, nearly a decade later. This was a terrifying case, not just because of who it happened to, but because it didn't have to happen. So I hope you listen closely to this story Dr. Crandall is about to tell you in his own words. It is 100% true and just might save your life.
It was the fall of 2002. A middle-aged man returned to LaGuardia Airport for his flight home following a business trip. As he pulled his travel bag out of the back seat of his car, he felt a sharp pain in his left shoulder. As most of us would, he shook it off as a minor muscle pain. And when he boarded the plane, the painful sensation stopped. When his flight landed and he picked up his bag again, the pain returned. Yet by the time he got home, he felt perfectly fine. Later that evening, he was so excited to see his family, he barely noticed the pain. It began to bother him again. It certainly wasn't severe enough to prevent him from taking his sons on an outing. He'd stop and rest, feel better, and try to catch up with his kids, but then immediately the soreness would return. For a second, this man did consider if the pain was coming from his heart. But he was, after all, only 48 years old. He didn't smoke. He didn't have any family history of heart disease. He wasn't a diabetic. So the next morning, when he felt perfectly normal, he decided the pain must have been a fluke or brought on by the stress